Diseases caused by cats. There are many medical conditions that cats can transmit to your body. The following are some of the most common diseases caused by cats. 1. Campylobacteriosis. The transmission of Campylobacter bacteria can cause a disease called Campylobacteriosis in both animals and humans. People become infected with Campylobacter by coming into contact with the feces, dander, or food of infected animals, including cats, or by consuming contaminated food, water, or open wounds. It's worth noting that cats usually become infected by eating contaminated raw meat. Anyone can contract Campylobacteriosis, but the following groups are at increased risk: individuals with weakened immune systems, children under the age of 5, adults over the age of 65. Some symptoms that may indicate Campylobacteriosis may occur, such as diarrhea, fever, stomach cramps, and nausea. 2. Rabies. Rabies is a viral disease spread by the bite of an infected animal. Cats are considered the most susceptible animals to rabies, which attacks the central nervous system, causing a variety of symptoms. Therefore, you must ensure that your cat is vaccinated against rabies, even if your cat stays indoors. Avoid contact with wild cats, and receive immediate treatment if you are bitten by an animal. 3. Plague. Plague is a serious infection that affects humans and is caused by a bacterium called Yersinia pestis. It is usually transmitted through the bite of a flea that feeds on an animal, such as a rat or cat. It causes ulcers and abscesses in the glands of the arms and legs. The disease can also be transmitted to humans through contact with cats. Cat scratch disease. Cat scratch disease is a disease caused by the bacterium Bartonella henselae, which is transmitted to cats by fleas. This infection can be transmitted to humans through exposure to a cat bite, scratch, or lick. It is one of the most prominent examples of diseases caused by cats. 5. Salmonella. Salmonella poisoning is caused by a group of bacteria called Salmonella, which is transmitted through eating contaminated food or touching infected cats. Although Salmonella usually clears up on its own, some infected individuals may require medical attention to treat severe diarrhea, gastrointestinal disturbances, or the effects of the infection. Kittens should begin receiving vaccinations against diseases when they are 6 to 8 weeks old and continue until they are 16 weeks old, then resume vaccinations after a year. Adult cats require fewer vaccinations than kittens. Your cat may need additional doses depending on the amount of time it spends outdoors, how often it is around other cats, and the diseases common in your area.